Starting with vaginal Candida, we have discussed on the show in the past this wonderful study, 2015 randomized control trial, that 1,500 milligrams per day, so a 500 milligram capsule taken 3 times per day, was as effective as fluconazole, the medication, for vaginal Candida. The good news does not stop there, however. Another compound known as horopito, or sold oftentimes under the brand name of Colorex, this is a herb native to New Zealand, has been studied in a couple clinical trials, one of which I find very exciting. 2011 randomized control trial. Half of the women were given itraconazole, the medication for the pharmaceutical, for 6 months, and then monitored for an additional 6 months. And the comparison group was given horopito for 6 months and then also followed up for 6 months post-treatment. Look at this, the cure rate. Itraconazole, 34%. Not bad. Horopito, 66%. And this group had significantly fewer relapses than the itraconazole group at the end of the 12-month study. There are also other herbs that you can consider. Chamomile extract or sage have also been shown to be beneficial for vaginal Candida. The sage was used as a vaginal deposited tablet, and the chamomile was used as a cream. I also want to make sure to mention that probiotics are powerful antifungals. 2023 randomized control trial, probiotics were found to have similar efficacy, again looking at the pharmaceutical fluconazole as the comparison when treating vaginal Candida. And the good news with probiotics does not stop there. A group of researchers wanted to study the body of evidence more broadly, and they performed a meta-analysis summarizing results from 6 different randomized control trials. I'll just quote, "Probiotics showed a favorable effect in the treatment of vaginal Candida." So for vaginal Candida, you have some great options. And by the way, if this has been helpful, please comment and subscribe. This really does help us reach more people who are trying to improve their health, so it is quite deeply appreciated. Coming now to oral thrush. This is the white tongue, potentially bad breath. The strongest evidence, this is in vitro, so let me take a step back and clarify. There is more research on the pharmaceuticals. This is where I do feel the pharmaceuticals have an edge. So in this case, the best data we have is not the randomized control trials like we talked about before, but rather in vitro evidence showing that these oils, out of all the ones studied, or you could do a tincture, were found to be the most powerful antifungal. Garlic, cinnamon, and lemongrass. You can buy these as an oil or as a tincture. Simply put a few drops in water and then use 1 or 2 minutes sort of as a mouthwash rinse. And the way I'd recommend using this is swallowing the rinse afterwards, and then don't eat or drink anything for at least 15 to 30 minutes afterward to allow that to sort of sit in the mouth and have the antifungal effect. It wouldn't be a smart idea to do the mouthwash and then eat right afterwards because you're kind of going to wash it all out of the oral cavity. There are a few others that have also been shown to have antifungal activity, including clove, oregano, and neem. Once more, I want to echo the power of probiotics. In this case, a 2019 randomized control trial summarizing the results from 8 different studies. And they used either a Saccharomyces probiotic in some of the research or different blends of lactobacillus and bifidobacterium probiotics. And like we've discussed in the past, if you take an honest look at the research literature, you see that different clinical trials with different lactobacillus, different bifidobacterium are all having benefits for fungus. So I don't think a highly specific formula is needed to improve, in this case, oral Candida. But quoting from this meta-analysis, we are confident in declaring that probiotics can have a beneficial effect on reducing oral Candida counts. So I would suggest to pair whatever herbal intervention along with probiotics.